Menopause. It's a word many women hear, but few are truly prepared for. Some think it's just about hot flashes. Others believe it's simply that age when periods stop. But menopause is much more than that. It's a biological transition that affects the brain, hormones, bones, heart, metabolism, mood, and overall quality of life. Today, we're going to talk about what menopause really is, why symptoms feel so intense, what is normal, and what is not, when to seek medical support, and how the right testing and care can make this phase healthier and calmer. Before we continue, if you find health information like this helpful, we invite you to subscribe to the Sparsh Diagnostic Centre channel. We share science-based videos to help you understand your body, take informed decisions, and stay proactive about your health. Menopause is not a disease. It is a natural biological phase. A woman is considered menopausal when she has not had a menstrual period for 12 consecutive months, without pregnancy or other medical causes. Average age is typically between 45 and 55 years. In Indian women, it often occurs slightly earlier. What actually happens? The ovaries gradually stop releasing eggs. Estrogen and progesterone levels decline. The brain and body must adapt to this hormonal shift. Menopause is not an overnight event. It is a process, not a moment. The 3 stages of menopause are: 1. Perimenopause. This is the transition phase, which may begin 5 to 10 years before menopause. Common signs include irregular periods, mood swings, sleep disturbances, weight gain, anxiety or irritability. Many women don't realize they are in perimenopause and feel confused by sudden changes. 2. Menopause. This is officially diagnosed after 12 months without periods. Hormone levels are now consistently low. Symptoms may peak during this phase. 3. Postmenopause. This is the phase after menopause, lasting the rest of life. Some symptoms reduce, but long-term health risks increase if not managed properly. Menopause affects every system, not just reproduction. Physical symptoms include hot flashes and night sweats, fatigue, joint and muscle pain, vaginal dryness, hair thinning and skin changes, weight gain, especially around the abdomen. Emotional and mental symptoms include mood swings, anxiety or low mood, brain fog, memory issues, reduced confidence. Sleep problems include difficulty falling asleep, frequent night awakenings, poor sleep quality. Many women are told, "This is normal, just tolerate it." But suffering is not a requirement of menopause. Menopause symptoms feel overwhelming because estrogen affects the brain. Estrogen influences serotonin, responsible for mood regulation, dopamine, responsible for motivation and pleasure, temperature regulation, sleep cycles, stress response. When estrogen declines, the brain struggles to regulate temperature, hot flashes. Stress tolerance reduces anxiety and irritability. Sleep becomes fragmented. Emotional resilience decreases. This is biology, not weakness. Menopause doesn't just change how you feel. It changes long-term health risks. Bone health. Estrogen protects bone density. After menopause, bone loss accelerates. Risk of osteoporosis and fractures increases. Heart health. Estrogen supports healthy cholesterol balance. Post-menopause, risk of heart disease rises. Metabolic health. Increased risk of type 2 diabetes, abdominal obesity, fatty liver disease. Mental health. Higher vulnerability to depression and anxiety. Cognitive changes may persist if unaddressed. This is why regular screening matters. You should seek medical guidance if symptoms interfere with daily life. Periods are excessively heavy or irregular. You experience sudden mood changes. Sleep disruption is severe. There's unexplained weight gain or fatigue. You have a family history of osteoporosis, heart disease, or diabetes. Menopause care is not just gynecology. It is whole body medicine. Menopause is not the end of vitality. It is the beginning of a new biological chapter. Understanding your body is the first step to caring for it. If you or a loved one is navigating menopause, early testing and informed medical guidance can make all the difference. This video is brought to you by Sparsh Diagnostic Centre, because women's health deserves clarity, compassion, and science. Subscribe to our channel for more health education you can trust. To consult a gynecologist at Sparsh Diagnostic Centre, call our helpline number 983-011-7733.